Greetings and welcome to this week's Prompt Insight. My name is Gavin and I'm the Marketing Director here at BlastOne. Today we're discussing and demonstrating the dangers of accidentally injecting yourself with an airless spray gun. Getting paint into your bloodstream and inside your body is a serious health issue. So we're here to remind you that working with a high pressure airless spray gun is very serious and a very dangerous activity. In this video, Kerry is going to demonstrate on a piece of meat what would happen if you accidentally injected yourself with an airless spray gun.
So the airless gun and tip that we talked about before has the capacity to inject me. So to give you an indication of just how powerful that is, this particular airless pump that we're using today for this top coat polyurethane, and this is very thin, what we've done is we've put a piece of meat on the wall up here to show you how easy this is to penetrate your skin. So say for example I had that up against me, or I bumped myself and I pulled the trigger. That's this sort of injection I'm talking about. So basically what that's done is that's gone way into that piece of meat. So that is the same configuration as your skin. So if I do it again, there you go, you see it's got a fester and then the paint is running out, fine, but there's also a significant amount of paint that's actually penetrated that piece of meat. So it fills it up, it loads it up with the hydraulic capacity of the material, and of course it's shoved it straight into that piece of meat. So this piece of meat, guys, is exactly the same as your skin. So if you're not careful and you pull that trigger, you can see here how it's cascading out of the hole, but as I push it, more paint runs out. That's exactly what will happen to you if you're not very careful.
So as you can see, it's no joke to have this type of accident. Kerry's now going to give us what you should do if you accidentally inject yourself with an airless gun.
What I want to talk about is the injection from an airless application. So if you depress the trigger and your hand or any part of your body is too close, it will enter your skin. So what would I do if I shot myself with an airless gun? Heaven forbid it never happens, but accidents happen. So if I shot myself with an airless, or a hose burst, or a fitting came loose, there's an instantaneous squirt of material that will enter the body. It's got to be treated like a snake bite. So basically what you're looking to do is, with bandages, you will put a bandage over, you won't cut it open and try and suck the paint out. You'll see that there's just a little mark and it won't bleed much, interestingly enough. So you will cover the wound and then you will use a pressure bandage to bandage that limb up as far as you can and keep it slightly elevated. And then, of course, you'll seek medical assistance immediately. So that means ambulance, hospital. And that's why I mentioned the high pressure injection card. It's a medical alert card that gives the physician some indication of what you've just done. So fundamentally when they look at it, they say, oh, it's just a little scratch or a small mark on your skin. You've got to understand that you've just injected your body with the fluid in which you were trying to apply. So it's important that that is looked at and treated accordingly to an injection. So pressure bandage, elevated, straight to the hospital.
Thanks for watching this week's Prompt Insight. See you next week.